Thank you for joining us today. We're now going to go ahead and get started. Stephanie?
Hi, hello, and welcome to our discussion today of the Senate Finance Committee's hearing with Health and Human Services Secretary Robert F. Kennedy Jr., who, and this might be understating it, has faced criticism for his health agenda and a leadership shakeup at the Centers for Disease Control and Prevention. I'm Stephanie Armour, Senior Health Policy Correspondent for KFF Health News. I'm joined today by two of my colleagues, senior correspondents Arthur Allen and Julie Rovner, as well as Joshua Michaud, an Associate Director for Global Health Policy at KFF. Arthur was at the hearing Thursday. I would note that it was extremely combative and somewhat extraordinary. Arthur, can you paint a picture of what it was like in the room?
Yes, well, I noticed sort of four different things. First, you're right. It was really very nasty. I'm old enough to remember when witnesses in Congress didn't like talk over the senators and accuse them of being stupid or ridiculous, as Kennedy did several times today, including responding to Republican Senator Bill Cassidy as "you're wrong" a couple of times. It was also just notable that the GOP, there were three Republican senators who seemed to be very skeptical of what Kennedy has done with vaccines so far. And I was also just struck by how kind of uninformed Kennedy seemed to be about, for just plain questions about what people were doing in his administration. He still didn't know what David Geyer, who was hired, I think, back in March, he still couldn't give an answer of what exactly he was doing. He's apparently doing something to do with this autism study they're doing. And finally, it was just kind of a level of absurdity that was reached because he was asking senators really to trust him more than scientists, career scientists who aren't in the habit of lying in public. And everybody knows that politicians lie. So why would you, even if you love Robert F. Kennedy, why would you trust him over career scientists? Anyway, those were the things that jumped out at me.
Interesting. One quick question. Senator Cassidy, he's really the reason that Kennedy's nomination went through. What was your sense about how he was today at the hearing?
Well, I felt that both he and the other two senators, Barrasso and Tillis, were very critical, but they were also cautious in that they're not joining the Democrats in calling for him to resign. And also they seemed like they were trying to slow him down a little bit. That was sort of my feeling about what they were trying to do, because they didn't propose anything specific like, we want to hear from you by X date about what you're doing on this. It was critical, very clearly so, but not asking for anything.
Well, we're going to talk amongst ourselves for about 15 or 20 minutes, and then we're going to open it up to your questions, which you can submit in the chat box. So off we go. This has been a much anticipated hearing because Kennedy has narrowed eligibility for COVID vaccines despite no new safety data, and he fired all members of a vaccine advisory board and replaced them with his own picks. Last week, he fired CDC Director Susan Monarez, who had just been confirmed on a party line vote in July. She said in a Wall Street Journal op-ed today that she was told to pre-approve the recommendations of Kennedy's new vaccine advisory panel, which he filled with people who publicly expressed anti-vaccine rhetoric. What does today's hearing mean for Kennedy's ability to continue his march toward narrowing access to vaccines? Did his testimony help calm the controversy or add to it? Let's play the first clip.
All these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
I think that parents should be free to...
I know you said that before. I do too.
To make their own choices.
This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology.
Interesting. That was quite a clip. How did his defense play out, do you think? What do you think? How did this resonate with lawmakers in terms of what Kennedy was saying about access and availability?
Well, I didn't personally, I'll jump in. I didn't think that anyone seemed to be very moved in either direction by what he was saying, including the three Republicans who were skeptical. I was just struck that he always kind of goes back to the same talking points, which is that anytime somebody criticizes what he does, he says, well, look, you've been in charge for X number of years. Chronic diseases have gotten out of hand. And then also falls back on anytime a group, like a group of physicians or so on is critical of him, it's, oh, you're in the bag of pharmacy and pharmaceutical industry and you're corrupt. And so it's kind of it's a circle that doesn't get anywhere because he never cedes any ground. And I think that people who believe fundamentally in what he's doing or believe in Trump, and so they're willing to go along with it, didn't seem to be very moved today, one way or the other.
Can I underscore something that Arthur was saying before, which is that, when we saw Kennedy in his confirmation hearings, we learned two things. One, he didn't know very much about how the department works. And two, he was really rude to members of the Senate who were in charge of confirming him. And both of those things were still true today, 8 months
Even ruder
later.
today, I thought. Yeah.
Yeah, that he continued to be rude and he continued to not know very much about how the department works. And in terms of, is this going to make it easier, particularly for Republicans, to defend him? Probably not. It was not, in contrast, when Dr. Oz, who now heads the Centers for Medicare and Medicaid Services, came up, he knew exactly how to testify before Congress. You're very deferential. If you don't know the answer to a question, you'll say, I'll get back to you, not, I don't know. There is sort of a performative aspect to this that I imagine every witness is briefed on, but it just either didn't take with Kennedy or that's not his persona. His persona is apparently to be combative, and that's what he was.
I mean,
I noticed how many times he said gibberish, like telling lawmakers what you're saying is gibberish. That did stick out. It's a good point.
I wonder if it's just partly, though, that with this administration, the fight back and never admit you're wrong. I mean, it's pretty basic. It certainly trickles down to his level. He's a Kennedy, so how dare anybody criticize him?
I mean, I'd only say that, this hearing comes at a critical time, and the clip showed the senator talking about how parents were confused and how there's, it's just some general concerns about how vaccine access is going to go. The firing of the CDC director just a month after she had been Senate confirmed, the ongoing cuts to both funding and staff at CDC, the gunman recently shooting at CDC. There's been a real crisis of confidence both at CDC and then, as our KFF polling has shown, a decline in trust in the institution itself. So, the extent to which Kennedy can implement further restrictions on his vaccine policy is not going to be helped by a complete destruction of the capacity of CDC and further eroding of the trust of that institution. So I do sense that there will be, if we're talking about childhood vaccines, some of the things going beyond COVID, and there was a lot of controversy about COVID vaccines, and we can talk about that some more. But when you get into the childhood vaccines, which are the bedrock of public health prevention and mandated by all states, then you're talking about treading into new territory, and the temperature might be raised around those if those become the next targets for Kennedy and his campaign against vaccines.
And I think we might know a little bit more if the Vaccine Advisory Committee meets as planned in, I think it's September 18th. So I think that will be closely watched. That's a good point, Josh.
I wonder.
Yeah.
Okay. Well, I was just going to say, I wonder if taking away hepatitis B birth dose is going to really upset a lot of parents, though. I mean, I think they could chip away at it if they're strategic. And before you know it, they're going to be questioning everything. But I think that certain things, I agree with what Josh said about, COVID is is a separate issue from childhood vaccines, from other childhood vaccines, but I do think there are ways they can get into that too.
Yeah, I mean, hepatitis was raised by a couple of senators, both in support of continuing hepatitis B vaccinations. So we don't know where that line will be drawn and whether the goalpost will move over time, but it certainly would be yet another controversy to add to the to the many controversies already.
One of the things I noticed, even among the Republicans who, were trying to be critical of the secretary, was how much they wanted to separate him from Trump. They seem to want to make it very clear that even though they don't necessarily agree with what Kennedy is doing, they don't want that to reflect for them. They don't want Trump to think that he's against him. And so, this ended up, how many of them mentioned Trump really should get a Nobel Prize for, overseeing Operation Warp Speed that gave us the COVID vaccines. And by the way, you're not living up to that. I mean, they were trying to sort of bifurcate sort of what Trump did during COVID with what everybody else did during COVID, which is part of what Kennedy was criticizing. But also, they want their criticism of Kennedy to not be mistaken for criticism of Trump. I thought that was kind of artful.
Yeah. Speaking of artful, what about Kennedy saying that he thought he should get that Trump should get the Nobel for for Operation Warp Speed, and also saying that it resulted in kids dying? I mean, okay, what?
That was a tough needle to thread for sure.
It was.
Yeah, and
That was.
it was,
Well, and Kennedy did say he didn't know how many people died of COVID and if the COVID vaccine saved lives. Let's play the next clip on that.
To just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID? I don't know how many died. You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID? I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there were so many perverse incentives. And these are modeled.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved
and
lives?
that's the problem, is that they didn't have the data. The data by the Biden administration absolutely dismal.
So who was politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said. Go to the Trump Surgeon General.
I thought that was a really interesting exchange because it gets to kind of how Kennedy has expressed concern with CDC and how he feels like it's sort of subject to regulatory capture, as well as his claims that there's political bias there. How did that play with lawmakers, do you think? And was Kennedy able to sort of successfully defend what he's been doing?
Well,
Josh, correct me. Josh, correct me if I'm wrong, but wasn't it the Trump politicals who were interfering with CDC in 2020 when they were trying to collect the data at the outbreak of COVID?
Yeah, Trump famously talked about not liking the numbers where they were early on because he didn't want more testing to occur. But yeah, there was always concerns around the numbers and whether the data were there to say what they wanted to say. Now, were COVID data questionable? Yes, you could have questions about the COVID data. And were there things that could have been done to get a better sense of exactly how many lives were saved? Sure. But to just say that you don't have enough information to say whether more than 1 million lives were saved by the COVID vaccines seems to fly in the face of available evidence, and not just US evidence, but global and European countries and a whole lot of other evidence. So whether or not that point about, I can't say whether the vaccines actually save this many lives or not, is something that would struck a nerve with the rest, the senators, then it's going to, we're going to have to wait and see whether that's a winning argument. But just a general theme through Kennedy's discussion, including the discussion about this data, was, as Stephanie said, who do you believe here? Who's corrupt? Who's not? And that is a question that he, as a perspective of someone who is not part of the industry and not part of the government prior to taking this position, is in a position to say what is the real truth, what is free from interference and corruption. Whereas, Senator Sanders and others have come out and said, well, no, actually, we have doctors groups and a whole lot of evidence saying the opposite. So that is a tension which ran throughout the hearing.
Right. Well, and one thing I know that Kennedy has raised questions about clearly the COVID vaccine, but not just the COVID vaccine. On that note, let's play the next clip that came up.
The data from that study showed that Black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety scientist at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DeStefano, who's the head of the immunization safety branch, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
I can comment on that one because I interviewed William Thompson years ago, and it's true that there was a signal that Black boys were getting, that there was an unbalance, but in the data there that they were getting autism at higher rates if they'd had MMR. But the reason for that is because the sample of Black children in this study was low, and also in order to get an autism diagnosis, you had to have had an MMR shot, and the MMR vaccination levels were higher in the white population. So, I mean, it just, it's a thing that Thompson was disturbed by, and he has some issues, but it just washed out. There's nothing to it, and it's 20 years old. It's a 22-year-old story, and they just keep, bailing it out. There's not very much there. I mean, it's like there's not a complete absence of, corruption or something in these agencies, but just overall, if you look how many COVID studies there are, COVID safety studies, there's, thousands and thousands. And it's like, what are you going to believe? And it does come down to who you believe.
It's interesting. Yep. Well, and one last thing. Yes, that's a really good point. I think just in the interest of time, because we also want to get to some of our viewers' questions, let's just play one more clip with Kennedy talking to Senator Warren about the ability to get vaccines.
Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
What are we seeing in terms of people's ability right now to get the COVID vaccine, and what do we know has changed under Kennedy?
Well, what we're seeing is a lot of confusion, as evidenced by the questions here, and part of that has to do with the fact that, as we mentioned earlier, the committee, the ACIP committee, has yet to meet to discuss the vaccines. So we have an FDA regulation which has come out saying that these vaccines for the coming season, the new vaccines, are limited to those people who are 65 and older or have a health condition which puts them at high risk. And until we get an ACIP recommendation regarding these vaccines, there's still insurers don't have the information they need. In fact, many states, in terms of their pharmacies, won't be able to get people the vaccines until there is an ACIP recommended, there's an ACIP recommendation for this vaccine. So right now we have a very inconclusive sort of a situation where some places you can get the vaccine, some places you can't get the vaccine, places you need a prescription, and others you don't. And so that's led to all of this confusion. And the questions about insurance coverage and whether people will have to pay for it out of pocket is another aspect of this.
But Josh, even if ACIP follows along what the FDA said, which was, over 65 or under 65 with a high-risk health condition, that doesn't mean that somebody who's under 65 without a high-risk health condition can necessarily walk into the pharmacy and get a vaccine, right?
It's not 100% sure. That's for sure. There is the possibility of off-label use, and in the case of some states, you might be able to just walk in and say that you have a condition or whatever it is, and get the vaccine and be covered for it. But in some cases, you might actually need a prescription from a doctor to get that done, rather than just walking in off the street. So yeah, it's still unclear, and insurers haven't all said what's going to happen in the future on this too. So it remains to be seen.
Seems like a lot of it depends on,
Arthur. Yeah.
seems like a lot of it depends on the insurers, like if they see it in their interest to continue paying for it. It's not like paying for a triple bypass surgery or something. And ostensibly it'll make people healthier. So anyway.
Yeah. One thing I think that must be confusing for people is you're seeing these different recommendations, like the American Academy of Pediatrics, breaking with Kennedy. So I think that's also causing a lot of question in consumers' minds too.
Absolutely.
But I'd love to open it up to some of the questions we're getting from viewers, because we're getting a lot. One question that I think would be good to put out is how much damage could ACIP, that's the Vaccine Advisory Committee that Kennedy fired and then put new members on, how much damage could ACIP, the CDC, and Kennedy do to vaccine access in the near future?
Yeah, this is something that we've written about. The federal government does have a role in setting vaccine policy, mainly through making recommendations, and those recommendations, start with the licensed vaccines that are approved by the FDA. Then the CDC, through its ACIP committee, reviews the public health use for these vaccines and makes recommendations to the CDC director, and then the CDC director makes those recommendations to the broad public. But when it comes down to it, it's the states and local health departments that are making the decisions about vaccine policy and what is required and what is not. So what you could see from ACIP in the short term, if they wanted to go this route, and you're already seeing the genesis or beginning of this, more emphasis on the risks for certain vaccines. So there's a study group going to be looking at the COVID vaccines and raising risks about potentially raising concerns about the risks for those vaccines, which previously had not been unearthed, according to some of the supporters of this. And you could see a similar tactic taken to other vaccines, where the adverse reactions or the negative aspects of vaccinations are emphasized in the communications coming from ACIP and CDC. And then that leaves the local practitioners, the state health departments, and others to make decisions based upon what will be conflicting recommendations, because, as you said, other organizations, the American Academy of Pediatrics, the American Medical Association, might be making conflicting recommendations. So it's a very difficult and confusing situation to be in that sense.
Yeah, I think that if you have, I mean, the ACIP has already shown that, and CDC have, under Kennedy, have already shown that they can cherry pick data. I mean, there's plenty of garbage studies out there, I mean, in my opinion. But anyway, that would certainly come to different conclusions than what the mainstream of pediatric health providers would believe in. And so what you'll end up is two different recommendations, one from the government and one from professional groups.
Another question from a viewer. Why is it so difficult to give RFK Jr. a chance? Our current system isn't all that great.
Well, he is getting a chance. He's the Secretary of Health and Human Services, and he seems to be doing pretty much whatever he wants. I mean, he's exercising the kind of authority as secretary that we have not seen before. Reaching into the ranks of the career professionals. And he said at the hearing, today, he said we've already kind of, he didn't use the phrase cleaned house, but we've gone into NIH and FDA and CMS and the other agencies, the other large sub agencies of HHS. And basically done things that previous political appointees, including secretaries, have not done before, many of which are in court. They fired people, which may or may not have been legal. They have stopped spending money, which was appropriated by Congress, which may or may not have been legal. So there's a lot of things that he's doing to remake the department. And a lot of it Congress could be stopping if they wanted to, and they don't seem to want to.
Yeah, go ahead, Arthur.
So many of the things that they've been doing, I mean, as reporters, we find lots of people who object to them and say they're irrational. That people who've worked in numbers of different under different presidents and Democrat and Republican, and what we don't often get, I find anyway, is explanations really for what the end game is, other than these very big sort of generalities. And superlatives about what they're going to do. They don't really explain, well, why did you go about it this way?
And I would certainly argue that Kennedy has been able to do a lot unchecked, especially when it comes to a lot of the food additives, and you're seeing a lot of companies making voluntary changes. So it does seem like he's definitely having an impact on areas beyond just vaccine.
Yeah.
One question, this I think is probably one that a number of viewers may have. If the new ACIP meeting in the next few weeks doesn't meet and no recommendations are forthcoming on COVID vaccines, how will providers make decisions?
Yeah, well, we've had Senator Cassidy say that the ACIP should be postponed. The meeting should be postponed, as we're seeing, trust erode and the people that are being appointed question the safety of vaccines, which is in his mind is not warranted.
Did he? I'm trying to remember in the hearing. He didn't bring up postponing or delaying the meeting.
Not in this hearing, but he had said it previously, right?
Yeah, no, yeah, exactly.
Yeah,
but I was kind of surprised. I thought perhaps that would come up again at the hearing today.
Yeah. That was surprising. But it's it's not entirely clear. We'll be in the same sort of uncertain situation where you would have this vaccine out in the market without a recommendation, and many insurers and many state pharmacies might be their policies might be linked to what the ACIP recommends. And so if that recommendation is absent, then you really don't know what to do in those situations, and different states might be doing different things.
And their liability concerns too, right?
Yeah. Well, yeah, if you're doing an off-label use of this vaccine, then that might be something that would be a concern, certainly, yeah.
And Kennedy has warned about that if people ignore the FDA rulings and go off-label, then that'll subject them to possible lawsuits. I don't know if that's really going to happen, but.
Right. And I don't know what it would mean in terms of eligibility under the Vaccine Injury Compensation Fund if it's used off-label. Does anyone know? That's one question I realized I don't have an answer to.
Are you talking about the COVID vaccine?
Yes.
They're under the other program, right?
Oh,
Yeah,
that's right. They have a
they're
whole
under the-
separate program. Yeah.
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 They're-
So if they're used off-label, I assume people would still be able to go get compensation through that fund.
Theoretically, you would.
Yeah.
Yes.
Yeah, I guess it's all we don't know. It's this uncharted territory, right?
Yeah.
And they revoked the emergency authorizations, right?
Correct. Right.
So
Right.
they're in sort of a bit of a limbo, aren't they? Because I don't think that they've been voted on to, I mean, do they automatically, I mean, and they're not recommended for children or pregnant women, which means those are the two things that get you onto the vaccine injury compensation program.
Mhm.
Since they're not recommended for them, I don't know. It seems like they're kind of in a limbo because it's the emergency use authorization ended and then they wouldn't have been put on the vaccine injury compensation. So maybe that means some enterprising lawyer is going to try to take them to court, a regular civil court.
Yeah.
An injury.
Right. Well, one other question that came in is, please discuss, if you would, the impact of anti-vaxxers like the Florida Surgeon General and the saying Florida children will no longer be subject to school mandated vaccines.
I was thinking about this today. I've been covering sort of the anti-vax movement since the 1990s. It's nothing new. But we've never been in a position where there are so many outspokenly anti-vax people in positions of leadership in government. I can't, we've always fought around the edges of, what kind of excuses can parents have to, not get their kids vaccinated? What kind of exceptions, could we have just religious exceptions or medical exceptions, or, they're always fighting over sort of little things, not we're just not going to require vaccines for kids to go to school. I never imagined in my entire career that I would see the Surgeon General of a major state stand up and say, we're just going to get rid of these.
Yeah, I mean, we've traditionally been somewhat exceptional in the US in having mandates for school age entry. A lot of other countries don't have it. They have other ways of getting kids vaccinated. They
have national health insurance programs, most
They
of
have
them.
national health. They have in England, you get mailed a postcard when your baby is born telling you who your pediatrician is or who your GP is and when they're due for their first shot. So there is an element of coercion in the US. It's always been there and it's always worked really well, but it's obviously fragile. And that's what's going to happen now is like if you start having states, I mean, even if only Florida were to do this, there are going to be lots of people in Texas or other places who are going to be saying, well, in Florida, they don't have to get vaccinated. Why should I? I mean, you can just see it becoming a huge, even bigger political issue.
Yeah, I'd only say that, that is it is a high bar to see that actually passing at a state level. It's not, it wouldn't be completely out of the universe of possibility. But we had some polling released from KFF this morning, along with the Washington Post, saying and asking people. We polled people in Florida and nationwide about their thoughts about whether school vaccine mandates were a good idea. And 80% of the nation and 82% of Floridians believed that school vaccine mandates were good, or they supported the idea of them. And that's been shown in other polls as well. So it's not like, and I would say this applies to Republicans. It applies to the majority of Republicans, even the majority of the MAGA, self-proclaimed MAGA people support these mandates. So I think it's a vocal minority that is out there saying we would like to eliminate these mandates, and whether or not they're able to push that agenda through, it's going to be.
So in Florida, Josh, do you understand it better than I do? Because I haven't maybe read it, but I mean, so just Ladapo's declaration isn't enough to make it actually policy there. Does it have to?
I understand there's a set of vaccines which are required under regulation through the health department, and that includes things like Hep B and maybe some others. But there are certain vaccines, sort of the core childhood vaccines, MMR and diphtheria and pertussis and tetanus, which are under law, Florida law, required for school
Hmm.
entry. So that would require the legislature to
I see.
pass a law or change the law in a way.
Yeah, and
where-
Ladapo even said that in his
Yeah.
declaration
Yeah,
that there would have to be legislative action to make this happen.
which is why there's a high bar in this case, I'd say.
I will note, Kennedy did say at the hearing he didn't think anything was going to be done with the MMR vaccine, right? I did remember hearing that, so that'll be interesting to see if anything happens with that down the line, I think. One question also, and this is a good question, if folks know the answer to this, will Medicare and Medicaid pay for the COVID vaccine for people who it's not approved for?
Well,
I
if
think
you're over
that might have
65, you're
stumped
covered with
us.
Medicare, right? So that
Right.
is recommended for those individuals.
Who are 65 and over, correct?
Yes, right.
Yep.
Although if you're on Medicare, if you're disabled and on Medicare, you might not be over 65. And depending on what your disability is, you might or might not have a high risk
Right.
condition.
High risk.
Right.
On a Medicaid, I'm sure that's going to be decided state by state, won't it?
I would think that's be a state by state decision. Right. Right. Well, and that gets to another question that this flows from the newly formed West Coast Health Alliance. One of the questions we got from a viewer is, do insurers have to listen to any decision coming out of this new group?
That's a legal question.
Yeah.
It gets into the weeds. I mean, it might be different in each state. I don't, like what kind of jurisdiction they have and.
Yeah, I think
or-
the only legal requirements are the ones in the ACA, right?
Yeah.
Meaning if ACIP rates it A or B, then you have to cover
Then
it.
you have to cover it. Exactly. Yeah.
I think, that it would depend on the state. And so those states, I don't know this for a fact, but might be, rewriting regulations so that instead of insurance being linked to ACIP recommendations, they are linked to the recommendations that come out of whatever body makes those recommendations under this new alliance. And so that's something that I heard the Washington state governor mention this morning in an interview, that they would be promulgating new recommendations. And, I'm not sure, but I do believe that would include, if this were to work out the way some people are expecting it to, not a mandate, but a legal link between recommendations made and insurance coverage. But we'll wait to see what happens there.
I feel like they're building this plane while it's flying.
Yeah.
That's a great metaphor, I think. Yeah. Yeah. Well, and that gets to one of the questions that our viewer had is at the state public health departments, what can they do to ensure vaccine access? That really seems to flow along those same lines. That a lot of this could play out state by state to some extent.
Yeah, and I think one of the things that a number of senators mentioned in the hearing, and I've heard a lot of Democrats mentioning, but sort of as an aside, is the whole Vaccine for Kids program, which again is linked to recommendations. And that's where an enormous proportion of kids now get those vaccines. It was created for kids who don't have insurance or who had insurance that didn't cover vaccines, which used to be before the ACA a lot more common. And so it is a way that a lot of kids do get vaccinated, but that's a federal program, and I don't know whether states can sort of link to that. That's another place where there's probably going to have to be somebody's going to have to go in and do a lot of tinkering under the hood.
Right. I would imagine like in health clinics, they're asking that question now, like, because they're the ones who they would probably stock vaccines for children vaccines, right?
Right.
Mostly. Yeah.
Right. I know that my pediatrician sent a note out that they are not stocking and don't have COVID vaccines, which I thought was striking. Yeah. This is an interesting question, and this is going to get, I think, into the legal weeds, but I'm going to ask it anyways. From a viewer, what is the process for RFK to be fired or forced into resignation? Is the president the only one who can fire him?
I meant to look this up about whether you can impeach a member of the cabinet.
I think you can.
Yeah, I believe you can too. I don't know that it's ever happened.
I don't think it ever has. Yeah.
But I mean, Congress could certainly, if it wanted to, they could have, they could simply have a vote of no confidence, which wouldn't do anything legally, but it would certainly send a message. I don't see them getting ready to do that anytime soon. But, generally the cabinet secretary serve at the pleasure of the president. The president gets to decide whether to keep them or not. On the other hand, now this is part of the argument about, Susan Monarez being fired by the CDC because she was the first CDC director under this new requirement that the Senate confirm her, that it had previously been an appointed post. Now it's a Senate confirmed post. And so she was saying, I'm not out here unless the president fires me. And as far as we've seen, the president hasn't said that he has fired her. The White House, spokespeople have said that they have, but there was, quite the back and forth about has she really been fired, because it's the president's decision.
Right. And I haven't sensed from President Trump or from the Republicans at this hearing today that there's a groundswell from Republicans in opposition to RFK. In fact, it seemed like Trump posted something on Truth Social that actually raised some questions about the vaccines that were developed under his watch, the COVID vaccines. So I correct me, do you folks feel like I'm off on that, or are you seeing more energy towards some kind of ouster of RFK from the Republican Party?
I think Trump is kind of holding his finger up to the wind and seeing which way it's blowing at this point. He seems to be sort of covering his bases, depending on how things go. I'm sure he was watching the hearing. And I think that's why the Republicans, I think, made such a point of saying, we're mad at you, RFK Jr., but we're not mad at Trump.
Right.
Yeah, I don't think Trump wants to get rid of him. I mean, they've bolstered the libertarian wing of the party, with this. And, everybody cares about health. So, and it resonates with people and new groups of people. I don't think they want to get rid of them. I think that would be, but nobody hires me to do political consulting. So I don't know.
Also, it takes some of the pressure off of Trump's other problems, look over there.
Yeah, to the extent that there's a headache caused by whatever actions, Kennedy takes, and that grows over time. I can see potentially taking, strict actions on vaccine access might raise a lot of the, political heat around his being secretary, and that might reach the level of the White House. But, it's very hard to predict how that will play out.
Yeah.
Well, and our last question, I think, kind of picks up on this, but it in the same vein, which is, after this hearing, sort of where do you see things going next? This has all been so much tumult with the CDC and what's happening with the COVID vaccines. Was there any hint from this hearing what we can expect next on some of these issues, or where we might go next?
I thought the message was from Kennedy that he's not backing down. And the message from the Republicans was, go a little, for most of them, or some of them, was go easy, don't go too hard. And I think that they're doing that I think they're going to keep on and, but sort of in a gradual chipping away. I don't know.
Well, and didn't Kennedy just appoint, or is looking to appoint, some additional members to the vaccine advisory?
Yeah, I haven't gotten a huge beat on them. A couple of them are notably, were foes of the COVID policy and vaccination. A lot of them are kind of obscure, and I mean, they're not sort of super well-known public figures, so it's a little hard to figure out where they're coming from. But I assume that they're not all gung-ho,
Well, and we reported that some sources close to Kennedy are talking about that committee looking to actually pull all mRNA COVID vaccines off the market. Is that something that we could see happen, do you think? Or is that too far-fetched? Or
I do think it's possible. Yeah. I mean, if you listen to what they're saying, I mean, it's just, maybe that is a bridge too far politically, I mean, clearly the people who are the current appointees in the ACIP would like nothing better than to do that. And he appointed them, and he clearly thinks the COVID vaccine is bad news. So how far is he going to go, right? I don't know.
And I assume that would be something the FDA would need to do in terms of the actual action. And I believe if they were to try and pull the licenses, that the manufacturers like Moderna would be able to have a hearing. But after that, I think the only other recourse is litigation
Right,
in
right,
terms of the process by which
right,
that could potentially happen.
right, right. Yeah, I don't know what kind of, I mean, what sort of hearing it would be either, do you?
No, just to key that well, perhaps they would present more information. You're right. I don't know exactly where that would
I mean, they
go.
would have to present some evidence saying this is why we're pulling it, but they've
Yeah.
pulled drugs, they've pulled things before. Yeah,
Yeah. Yeah. I definitely think that'll be something worth watching
yeah.
for sure.
I
Yeah.
also think it's worth watching, what's going to happen with the CDC, right? I mean, we've seen this leadership vacuum now. Two CDC directors, one who was never, able to get confirmed, and one who was fired a month after being confirmed. The cuts in funding and staff at the agency has left it, it's a very challenging situation at CDC, and morale is low among the staff there. So, where do we go from here on that? Well, it doesn't seem, Kennedy has talked about wanting to focus or refocus the agency on its infectious disease mission. And if you look at the budget proposals that are working their way through Congress for fiscal year 2026, you're seeing a range of things, but the cuts coming at CDC do away with a lot of the work that would support that infectious disease mission, in addition to other areas. And raises the question, like, what kind of institution is going to be there at the end of this process, and how far is Congress willing to go in terms of funding the priorities that Kennedy has put forth for CDC? So far, I haven't seen that come through very much in terms of Congress's budget bills. Kennedy and others have talked about major reorganization and changing the way CDC does business, but we haven't seen that yet in terms of the bills working their way through Congress. That's something I'm watching.
Yeah. The next big fight is going to be over budget. I'm surprised actually that so few senators asked about some of these rescissions and simply HHS holding back money. I mean, I keep hearing from career people at the department that, they have money that they're supposed to be getting out the door that they've just been stopped from getting out the door. And, at some point, more than just the appropriators in Congress are going to have to stand up and say, we have the power of the purse, you don't. And if we say you're supposed to spend this money, you're supposed to spend this money. That I was a little bit surprised that didn't come up today, but I do expect it to come up a lot more in the coming couple of weeks.
Especially since it was Senate Finance. Yeah. I kind of thought there'd be more on that too.
That's true. Maybe that's intentional. Maybe just distract them with all the vaccine stuff that drives everybody crazy. And then in the meantime, we'll just rescind.
Ignore the fact that they're not spending billions of dollars that Congress has instructed them to.
Right.
And so there was a lot of discussion. There was the absence of discussion of the major elements of the MAHA agenda. The ultra processed foods, and there was a nod in that direction here and there, but really that was not at all covered in this. And even though that was sort of the core of what Kennedy had in his opening statement. So whether or not that can actually come through, and he's talked about, there will be an action plan to come forth from the department to, they will take the steps towards enacting this plan to address ultra processed foods or contaminants and over medicalization of things that he highlighted, and the extent to which that can happen in the current environment is also something that I'll be watching.
Well, good. Well, I want to thank, first of all of our viewers for tuning in. I think this is really an important issue that we have yet to see how all of this is going to play out. And also Josh and Arthur and Julie, thank you so much for your thoughts and for being at the hearing and listening to the hearing. I know it was a little contentious, but you guys have had some great points. So really, thank you very, very much.